Welcome back, Dr. Ibe. Once again, I almost got told off by someone from this platform, a lady in her early 30s, who said, does it mean that only women over 40 should undergo a health check? I apologized to her and I equally reminded her that I had said in my earlier video that I would speak on women's health checks and men's health checks. So let's talk about women's health check now. And we had spoken about this robustly in the past. However, this once again is for people that joined us later. I mentioned that in women, as long as for women, indeed, as long as you've had sex once and you're over 25, we advise to have your smear test. Your pap smear test is a test done to pick up or identify if you have HPV. HPV is a human papilloma virus, and it's a virus that is sexually transmitted. These viruses, if they're found in the cervix, they could cause cervical changes that can then lead to cervical cancer. So this smear is done to see if you have this HPV, human papilloma virus 1, 2, or 3. There are 3 stages, just mild, moderate to severe. And in all these cases, anyway, you will be sent for further investigations, colposcopy, using a little light with a small tube to go through the vagina to look into the linings of the cervix to see if there are changes caused by this virus that could lead to cervical cancer. And once again, based on the findings, you may have to repeat the smear 6 months, a year, 3 or 5 years. Okay, that is the advice for women over 25 onwards till about 60, 61. For women over 50s, we do advise to have their mammogram done, just like X-ray of the breast, to identify if there are any texture changes, any cellular changes of the breast that can identify early onset of breast cancer. Okay, that is for women over 40s. In all these cases, anyway, cervical cancer, breast cancer, if you have a strong family history of any of these, cervical cancer, breast cancer, obviously the checks are much more stronger. You do them much more regularly. You don't have to wait for 25 or 50 years on. It depends on your healthcare provider, obviously, or the department looking after your mom, your auntie that had any of these cancers. Okay, and when it comes to teenagers, little girls that started that period, which we call menarche, first period, could be from age 9, 11, or 13. If you start experiencing like severe pain during your period, abdominal bleed, you bleed more than usual or shorter than usual, I would advise you see your healthcare provider who may send you for hormone profiles and pelvic scan to see if you have PCO, polycystic ovary, endometriosis, fibroids, and some other changes in the uterus, in the womb, in the cervix that can cause this abnormal bleed. Okay, so yeah, we have mentioned this robustly. Over 25s, you've had sex once, you need your smear test done regularly, please. Over 50s, you need your mammogram done to identify changes suggestive of breast cancer. If you're in your teenage age, younger girls having issues with your period, you contact your healthcare provider. If you notice any abdominal discharge, please, any abdominal bleed, anything outside the norm, you would have to contact your healthcare provider. Sometimes you may have to be sent for a swab. Swab means taking a specimen of the discharge and sending to the lab to know what is going to grow. So don't trivialize it. Don't say it's normal. Please, anything you know that is outside the norm and that doesn't correspond to how you are usually, please make sure you contact your healthcare provider, regardless of the age. And I had mentioned as well in the past that if you're a woman, you've gone past your period, your menopause, you bleed, even if it's just once, you must contact your healthcare provider for further investigations. Be safe and play safe. God bless. Bye.